Okay,
Mm.
everybody be on your best behavior now.
That's right. All right. Well, most of you know me, but I'm going to just go ahead and do a short introduction. As you know, my name is Jennifer Lopez. I'm a dermatology nurse practitioner here in Lake Wiley, and I just deeply care about my patients. I love being able to help you guys feel and look your best. And I feel like it's my job from a dermatology perspective to help you navigate through all the options out there and just find out what's really going to work best for your skin. And for a lot of years, I've recommended great skincare products, offered treatments like Botox, chemical peels, microneedling, to help with the skin with a variety of issues. But as we age, we all know there's only so much we can do. And a lot of people need greater help with either like skin laxity after weight loss or deeper hyperpigmentation, acne scarring. And so not everyone wants to have plastic surgery and there is definitely a room for like a middle ground. And even if you have surgery, there's upkeep. And so don't get me wrong, while there's a place for still all of these types of treatment options, the laser can provide more dramatic transformation, which you guys will hear about it. And it's what's nice about this is it can do it in a shorter amount of time. But there's a lot of different laser options out there, and not all of them give the most effective results. So after doing some research, I learned that compared to other lasers, the UltraClear laser technology just gives some pretty transformational cosmetic outcomes that you can really see the difference in before and after pictures, and with a much shorter recovery period. And then the best part about this laser so far that I've learned is it really does it safely. This is one of the first lasers that's really safe for all skin types. Um, so when I discovered the ultra clear laser, to me was a complete game changer and honestly just a no-brainer to bring it to Lake Wiley. Some of the transformations we've seen so far have been pretty incredible. And of course, there's always going to be times where people might need more than one treatment, but many people are experiencing some amazing results with just one session. Um, so there's a lot of advanced technology behind this laser. So I've invited my good friend Jim McPhee, who works with Aclaro. Aclaro is the company that brought this technology to the US. And he's going to help us explain what makes ultra clear laser just unique compared to other options out there. So without further ado, I'd like to hand things over to Jim.
Thank you, Jen. Hi, everybody. My name is Jim McPhee, and thank you for the introduction, Jen. I met Jen probably about 6 months ago now. And when we met for breakfast, I got to explain this amazing laser to her. I've been in the laser business for about 14 years. I've sold some of the most powerful and crazy lasers you've ever seen. And a few years ago, I decided to get out of the industry because there was not really anything innovative happening in the space until UltraClear came along. So what's really nice about this laser and what brought me out of my quote unquote retirement from the business is the fact that there hasn't been anything in the market in a long time that was super effective without a ton of downtime. So a lot of the CO2 lasers, if you all are familiar with med spa treatments or plastic surgery laser treatments, CO2 has kind of been the gold standard in this business for probably about 25 years. The only issues that CO2 had was you couldn't treat all skin types with it. And if you got really aggressive and wanted a really nice result, you were probably under for about, you would probably be red and torn up really bad for a couple of weeks and upwards of a month. So you'd have to schedule a whole lot of downtime. And that's really not in the cards for most people nowadays. People want a really fast turnaround. They want to look better as quickly as possible, but they don't want to sit at home and wait the 3 or 4 weeks that it takes. So this laser conquers a lot of those different issues. And it's really getting better results than anything that's been out on the market for a while. So what I'm going to do is I'm going to share my screen, take you through just a real quick tutorial about the laser and kind of what it's like. I'll show you some before and after pictures, and then we'll talk about kind of how the downtime looks so that you can plan for getting this laser treatment. I hope everybody can see, if you can give me a nod, give me a thumbs up if you guys can see this presentation. So the cool thing about this laser, it's the world's first cold ablative fiber laser. What does that mean? One of the challenges with CO2, like I talked about earlier, and older technology is that it uses a lot of heat and generates a whole lot of heat when you tissue. Heat can do a lot of damage. And so what this laser is, it's only got 5% coagulation compared to 60% coagulation from other lasers. So we're able to, we call it cold because it's the coldest of all of the ablative lasers. So it doesn't feel like an ice cube when it touches you. You're definitely going to feel some heat when you get the treatment and afterwards. But we numb your skin. We make sure you're very comfortable before we use the laser. But the difference is that heat not going into your tissue means it doesn't have to dissipate. So we can get much lower downtimes. And so I'll show you all of that as we go. First thing I'll show you is that I'm going to go right to the pictures. I'm going to skip through some of this stuff. Sorry about the skipping. We know that in this market, we were just talking with Brenda, if you guys were overhearing and eavesdropping on the conversation, Brenda grew up in Charleston, South Carolina. And a lot of us down here in the South have gotten a lot of sun damage over the years, right? Not everyone knew to wear sunscreen 20, 30 years ago, or even 10 years ago, and probably don't do it every day today. And what happens is we see this picture on the left where you get a lot of diffused sun damage, and you can see this over through a lot of people. You probably have a lot of friends and family that look just like this. This superficial treatment that you see up here at the top, this 3D miracle, truly a neat little treatment that you can do. Takes about 15 to 20 minutes in the office, and you don't even need any numbing to get this done. And this result, I know it says 1 month post one treatment, but that's when they took the after picture. You will typically see this pigment result in about 10 to 10 days. You'll see pigment start to slough off, peel a little bit after 2 to 3 days. And you're only red for about 48 hours, pink for about 48 hours. So this is a really, really nice result, and that can happen in just a few days or less than a week. But it takes about 20 minutes with no numbing. So very, very comfortable procedure. I'll go through some of the more aggressive treatments because I'm sure a lot of folks here may have some wrinkles, may have some skin tightening they want to do around their neck. But this is the most superficial treatment we have, very quick. We also use this for maintenance. Jen talked earlier about people that have had surgery in the past. Your skin doesn't stay perfect after you have those treatments. You want to have something to do with maintenance. We can do packages of these, and Jen will go through some of that a little later as well. But we can do packages of 3 of these, and you can do these once a year or twice a year just to keep maintenance going and keep your skin refreshed. It's really good for pore size as well. So it'll help you with a whole lot of different things. This is a really nice option. So skin of color is one thing we talked about a little earlier. There hasn't been a laser that can treat skin of color in quite a while. So if you have people in the family or friends that have darker skin types, they might not have options anywhere else in the area except here at Lake Wiley Dermatology. This is a really nice result. This looks just like melasma. And so we can actually treat melasma because it's a cold laser. It's a hormonal condition, obviously, so it can come back. But this result is excellent after just 2 treatments. Again, we do a series of these. This is in that 3D miracle mode again. But we're able to get rid of these tougher to treat skin conditions really, really easily. This is another nice result. This is a moderate treatment, not the lightest one, but definitely not the heaviest. And you can see all of this crazy pigment. She did 2 treatments, and you can see how glassy and smooth her skin looks on the right. So pigment is one of the major things that this laser does. But the more important one, in my opinion, is the one that everyone's really concerned with, and that is wrinkles. So if you have them, we can get rid of them pretty easily. This patient is in her 70s, obviously, so she's got a little thinner skin. You'll see that up here it says 2 treatments on this one as well. We can easily get this in 1 treatment. In fact, I'm going to introduce you to some people that have had a single treatment here in a little while from Jen, and they'll show you their results as well. But this is a 2 treatment series, and you can see not only did this device do really well on the wrinkles on her cheeks, but it did exceptionally well for all of this pigment on the rest of her face as well. So really, really nice result there. If anyone has any questions, I believe you can raise your hand and ask them if you'd like, but we'll do a question and answer session kind of at the end of this. My favorite picture in the whole deck. This is the hardest area of anyone's face to treat. This perioral area in the laser space has been probably the hardest to treat over the last 10 years. Everyone's looking for results for it. This is a result using laser coring as well as the UltraClear. So it's all in one device, all fired out of the same handpiece. So Jen can do all of this in a single treatment. So you can see the difference in her pigment, right? She looks nice and rosy and pretty in this right one where she had a lot of sun damage in the left. But the area that everyone concentrates on right now is this perioral area. And in one single treatment, 6 weeks later, you can see a huge movement on these wrinkles above her lip. and then this cobblestoning that happens on folks' chins as you get older. So if you're starting to see the signs of this coming in, we can definitely get rid of it a lot earlier and prejuvenate so that you're not really seeing this deep lines and wrinkles, so they're not as hard to get rid of. But this is a really good example of what it does for both deep lines and wrinkles and pigment on this patient. Show you a couple more things that are important. The reason, I'll go into the science real quick on why this works so well, and I think it's important to know. Older devices, they don't put as much energy in the tissue the right way. And so we kind of like calling this the Goldilocks of lasers, because some devices have holes that are way too big, some microchannels that are way too big that it generates in your skin, and it takes a long time to heal. Other devices have smaller microchannels, but a lot of heat that they put into the tissue. This device conquers for both of those. So you see a very small microchannel and very little heat. So we're able to pack in these areas of energy and damage that we're doing at the areas we need to in tissue to generate collagen at a much higher level than the other devices that have been out in the past. And that's why we see these results. But back to the results. Let me get some before and afters going here. Loose, crepey skin on the neck is a big problem. It's the one area of the body besides hands, which we can also treat with this, that we really see age. Other than the face and all the wrinkles that we can get rid of, this device can also tighten up necks. This is a really nice result both for the wrinkles on her neck, but also you can see all the sun damage that she had there as well. We've got a local patient that we treated with her neck, which we'll show you as well. I'll go back to pigment, raised SKs. This is a very large seborrheic keratosis, big brown spot with a lot of lumps and bumps. In 2 treatments, we were able to get this completely gone. And it looks like she has makeup on. That is not makeup. It is because her skin, she did get a tan, unfortunately. So she went out and got sun afterwards. But we got rid of a lot of the pigment around it and really that big brown spot that was bothering her. Another picture of an Asian skin, an Asian patient that had acne scarring. Really, really good result there. It treats traumatic scars as well. So if you know anyone that has either surgical or traumatic scars for any reason, this is after 1 treatment, 7 weeks post. We treated with the resurfacing tool on this device, and you can see that that scar is markedly improved. She probably wants to come back for a second lighter treatment just to clean that up a bit, but just a massive movement from one to the next. Fun patient. This patient had a chemical burn. So this is this device. There are a lot of chemical peels out there, and there's a lot of estheticians' offices out there that probably aren't as educated as they need to be able to deliver some of these more potent laser peels, or excuse me, chemical peels that are out there. This Dima Ali, this patient came to Dima because she had a massive chemical burn from a chemical peel gone wrong. And he treated her with 5 different RF microneedling and PDL treatments to get rid of the red and some of the scarring. So he got a nice result from A to B, but then got an UltraClear and did 1 treatment. And you can see that massive movement in the reds and the scarring from the second treatment to the third. So instead of doing 10 different laser treatments, you can do 1 and get a really, really nice result. So you don't need a whole bunch of treatments and a series of treatments to get it. You can see a lot of nice results. Everyone then asks, okay, it works. It gets rid of wrinkles. It can tighten skin. It does a lot of neat things. What does the recovery look like? And so don't be scared by picture number 1. This is how everyone looks after an aggressive laser treatment at every office in the world. The difference here is this would normally take 3 weeks or so, 2 to 3 weeks to get this turnaround. This is by day 5. So usually we tell people to give us 5 to 7 days of downtime. And the first 3 days are really where the downtime lies, right? This redness kind of gets a little, they get these squares from where we treated. They'll get a little crusty and then it starts to fall off. And then by day 4 and 5, they're looking back to normal. They can have chin and sunscreen, be back to work. You can really do that sometimes after day 3, but I tell people right at day 4 is when the massive turnaround happens. But this is consistent with every single patient that we see within 5 to 6 days. This first night is not fun. I will tell you that. You'll need to try to sleep upright. You can't cuddle with your pets and that kind of thing. But once you get through that first night, you start doing vinegar soaks, which is just a teaspoon of vinegar in a bottle of water. You do that for your whole face a few times a day, and it soothes the skin. You feel much better, and really quickly your skin will turn around. So if you do this on a Tuesday or Wednesday, by the weekend, you're usually in a really, really good spot. This is another more aggressive treatment. She really went hard. This is actually my rep in our St. Louis market. Jen got a really aggressive treatment. She wanted them. She's done lots of lasers in the past. So Jen asked them to go extremely hard. So they got some oozing, some pinpoint bleeding, and a couple big spots. But in 5 days, she was completely turned around. They went aggressive on her neck, so she still had some redness that went away a couple of days later. But you can see that she had a really, really nice turnaround in just 5 days. And Jen will have products that you can use. Jen will make sure that you are comfortable. She'll make sure that you have post-care that you can put on. The instructions are all given to you to make sure that this result can work for you. This gentleman wanted his eyes treated and under his eyes, and you can see, again, a nice little turnaround. Under the eyes, if we get more aggressive because it's thinner skin, it may take just a little longer, but you can see he was in pretty good shape at day 5, and by day 10, he was completely healed up. And these are the before and afters of under the eyes when we really do some hard work. This is no surgery whatsoever, no scalpel. The patient's under nothing but numbing cream, and we can get this kind of result from one to the next. So it doesn't just work on all the pretty ladies in the room. If your husband's eyes are looking a little tired, or if you have someone in the family that looks like this, don't look at my eyes. They look exactly the same as this, but I'm getting a treatment next week. But this is the kind of look that we can get in a single treatment. And 6 to 8 weeks is what we normally tell people to come back for pictures at, because that's how long it takes for collagen to be produced by the body and to replace itself and to really smooth out these wrinkles. Another really good one around the eyes. Eyes are tough, right? For a lot of people to get treatments on. It's extremely quick with us. This treatment takes less than 45 minutes. And again, in 5 to 6 days, you're healed. And right around a month, month and a half, you see a really, really beautiful result. Another one here. So really nice results around the eyes. We show a lot of these because that's everyone's kind of trouble area. This is one of my favorite pictures. We see quite a few folks with a lot of sun damage. We won't pick on Brenda at all. She told me that she didn't use sunscreen either. She's going to be on here in a minute. But this is what this laser can do in one treatment. So really, really nice result there. Now, we talked about neck tightening earlier. There are probably 10 or 15 devices over the last 10 years that have tried to tighten skin, especially around the neck. The hard part about this treatment is that most of the devices that have been out have been either radio frequency based or ultrasound based. The issue with those devices is twofold. One, you need 5 to 10 different treatments, and 2, they're extremely painful. And the third problem is they don't really get marked results that you can actually show people and say, look at how crazy these results are. This lady's neck there's no one asking if she got a really good result, right? Look at the difference in the depth of her wrinkle and how much tighter her jowls are. So this thing works exceptionally well on tightening up necks if anybody needs that treatment. Pitted acne scarring is also a difficult condition to treat. This woman came in and after one treatment in 3 weeks had a marked difference in, you could see the pigment results. But more importantly, these pitted acne scars, these deep pitted acne scars are really improved. And sometimes pitted acne scarring, depending on depth, can take multiple treatments, but we see a really nice result in just one. I don't have to tell you where the results are in this picture, right? Pretty easy to see. I'm also going to share a couple of, I'm going to pause this real quick. And what I want to do is I want to show you a couple of really good local results and a couple people that might be on this call. So give me a second and I will pause this presentation. Do we want to open it up for questions in the meantime before we show the local ones, or should I keep showing pictures, Jen? It's up to you.
Sure. Love to hear from anybody.
Cool. Let me do that real quick.
I see Debbie has logged on.
Hey, Jen. Hey, Jim.
Hey, Debbie. I was just about to show your picture.
Okay. I was sitting at the office
You were going to go there. Oh, you were there? I'm sorry.
Yes, and then I was driving, and I was trying to download Zoom on my phone, so and I was like, okay, but I made it home.
Hey, Debbie, let's tell the group. Debbie was a patient during our training session, or excuse me, our demo session that we did when Jen was evaluating the laser. And she came in and wanted to get her neck treated. She thought that her neck was really showing a good bit of age. Her face already looked beautiful, which I told her there. But while she describes kind of the process that she went through, which you can talk about that if you'd like to, I really want to show what her before and after looked like. And you can see her beautiful neck now as she shows it to you. But I think it's important to see what she looked like when she walked in. And this is how she presented. Can you guys see that? Thumbs up if you see it.
Yep.
Okay. So you can see this. She had a little bit of loose, crepey skin on her neck. So we used the laser coring mode, which basically uses the laser to core individual small little plugs of tissue, just a millimeter deep. Took about 30 minutes to do her neck. And this was right at the 6-week mark when I got this picture back from Jen, and you can see this incredible improvement in her neck. And now we get to see her beautiful face. So I'll bring you back up, Debbie, if you want to kind of show us what we did her face as well that day. So if you want to kind of talk to us a little bit, tell us what you thought of the procedure, how it went for you, the process basically on everything. Kind of tell us what your thoughts were.
Okay. I thought the process went good. The numbing cream really helped with the laser as far as the pain. Because on a scale, I think you said from 1 to 10, at one point I was like maybe a 5 or a 6. I do, right afterwards, it's really hot. You have to have you a little fan for sure. I had the fan on me all the way home and when I got home. And I did notice that the fastest thing that healed on me was my neck, and that was the one that had the coring. And I could actually tell that I was going to have good results in like a week. And then Jen came to see me, I think maybe the first week or whatever, but we were really amazed at how well my neck had done. And I've noticed my face as well. I can tell that it feels like my face is a little bit more fuller, like it's plumping up, I would say. And I have had people ask me, "Oh, your skin looks great." And I tell them about the laser and how it was. And the downtime was 5 to 7 days, a good 7 days for me. I did have some swelling, and some of that was my own fault when I didn't sleep upright like I should have. I tried. I did try.
It happens. I lay down sometimes on accident too with this kind of stuff.
Yeah, but I did my cleanings and I did my Aquaphor, and I I had a nice vacation at home while I was healing, and I'm 100% pleased with the results that I've gotten with just one treatment.
Well,
So thank you, Jim and Jen.
No, thank you for being a willing participant in the demo. I've been showing this picture internally to some of my teammates that are out there, and we're all very happy that you got that result. And this laser, no matter how long you're in the business, this thing continues to amaze me. When I see a patient and they tell me why they want this treatment, I'll leave some of the details out, but there was a very specific reason that Debbie wanted the results that she came in for. And it's amazing that it did it that quickly. It's amazing that now I get to see her face completely healed up because it took a little longer for collagen to start getting produced, but I can see a massive difference in her tissue on her face as well. Brenda, do you want to come up and kind of talk about your experience, I guess, with the laser as well?
Sure. Like you had said, I was born and raised in Charleston, hardly ever used sunscreen, or probably never used sunscreen as a child. So I had a lot of sunspots that were very concerning to me. And the laser completely took 99% of it away.
Okay.
It has done an amazing job.
Are you wearing makeup or tinted sunscreen tonight?
Tinted sunscreen is it. Moisturizer, yes. Tinted sunscreen is all I have on.
Okay. I asked that because I'm about to share your picture while you're talking, and if you want to, if you don't mind.
No, go ahead. Go ahead.
Share that
I definitely am seeing more results as it goes on. But yeah, that's the one my daughter commented on. She was amazed.
So
She
I
said,
can tell you, even since you took this picture, I can see a difference in your skin as well.
Right.
And we see a good 6 to 8 week, everybody, we see a good 6 to 8 week turnaround on tissue, like I talked about a couple of times. So this will continue to get better over the next couple of months. That 6 to 8 week mark is really where we like to take these before and after pictures. But yeah, I'm really happy with this result for you as well, Brenda. I'm glad that your daughter noticed.
I know. She texted me as soon as Jen put the picture up, and she's like, I can't believe it. So, but she sees me every day, so it's not nearly as dramatic as when you see it side by side like that. But I'm very, very happy.
Did you have the same recovery experience that Debbie had?
I did. I will say the first night was probably the toughest. But I was very aware of not letting my head lay down because I didn't want swelling. So like I said, I got up around 4 in the morning and got in the recliner and was able to go back to sleep. And after that, I slept fine. No problem at all. The downtime, mine was probably a full 7 days. But Jen was very strict about getting outside and wearing a hat and all of that. And I followed her rules. So I didn't want to mess anything up.
Well, you certainly didn't. So
I would do it again 100 times over.
Me too.
I met you in the waiting room.
Yes. Oh, was that you're the lady that I was talking
me.
with? Oh, okay. Yeah, I showed you some before pictures.
You did.
And after.
So everybody that's still on, we've still got a few people quite kind of watching. You can use the chat feature at the bottom if you have questions, or if you want to use the reaction to raise your hand if you have questions about the treatment, about any specials that Jen has going on, that sort of thing. If you raise your hand, we can bring you up and have you talk to these nice ladies that have had the treatments, and kind of go from there. So if anyone has any questions, we're happy to take some and hopefully get you these results as quickly as you'd like them. See if we have anybody raising their hand. No questions from anybody? How about we open it up a little bit? I'm going to have some people tell us what you think. I'm going to ask you guys to unmute one by one, if that's okay. If you've seen all these pictures, if you kind of tell me what you think. If you feel like unmuting, you can. You don't have to. Don't feel any pressure. But if anyone has any questions, they can unmute and ask them. It's an open forum. We love talking about this stuff.
I have a question. This is Pam, and Brenda's actually my sister.
Awesome.
So I'm already sold. So I guess my question is, I live in Charleston. So what is there a downside to not actually, being able to have the procedure done and then leaving Lake Wiley and coming back home, or how would that work?
There's not, as long as you're careful with the sun in your car. So the thing that I can get concerned with, if you can get one of those little shades for your driver's side window, if it's a really sunny, hot day, that can act like a little bit of a magnifying glass. That's why a lot of people have more sun damage on the left side of their face, or are more sensitive on the left side of their face. So what I would do is just get one of those little window shades that you can put up, the drawable ones that'll kind of shade a little bit of that, and keep your sun closed on your way home. Other than that, you shouldn't have an issue whatsoever. You're going to need that air conditioning working in that car, though. You're going to need a little bit of cold air blowing, because it's going to be nice, warm and a little toasty. But that's the only thing that I would say is the main difference. But it's not too far of a drive, just a couple hours away.
Right. Okay, good. Sounds good. Thank you.
Do you see a difference, Pam?
Yes.
Okay, I thought so. I could tell you could see a difference in your sister.
Absolutely. Yeah. She didn't tell me she was having it done, but then
I didn't.
I want you to look on this website on Lake Wiley, and I was going, oh my God. So I am, I'm very eager to have my turn.
Just remember that at night one, where everyone has said it's a little tender.
She'll be staying.
Remember how eager you were right now, and how exciting you'll be.
Right.
Anybody else have any questions? Anyone else think that any of these treatments would fit them, or where your concern areas? Feel free to kind of have a quick meeting with us and tell us what you think. Mary, I see you're off mute. Is there anything you wanted to ask?
No.
Okay.
I was just in case I did, I went off mute. But no, Jen and I've talked about it. And I've had some laser experiences before, and this sounds like the best one.
Yeah,
So,
I would say
yeah.
so. I've sold a lot of them, and nothing ever really compares to this,
Yeah.
especially like your neck or your, you have areas that are of concern. To not have to go back for 5 or 6 treatments and to get a one-time fix and see a massive difference like that it's unheard of, and it's really, really you deal with pain for a day to have lasting results for years, and so it's a really nice procedure.
And especially the recovery time being so much shorter,
Yes.
like you were saying. Yeah.
What have you had in the past? CO2?
Yeah.
I can see that.
And
You have beautiful skin, so it obviously works, but
oh,
it's
thank
taken
you.
a while.
Thank you. Do you know, I don't know what this laser particularly was, but it was called Profound.
Yep, I know the Profound.
What is that laser?
Profound is RF microneedling.
Okay.
And so it probably felt like a million little pokes that were going on all over the place, red and blotchy and big for a little. Yeah.
It was unbelievable. And I swelled like I didn't even recognize myself.
Yeah.
So it was no picnic, but I think this one will be so much better.
It will.
Sounds like, yeah.
I can promise you it will. Again, that first 24 hours, you just have to bear with us. But in 3 days after that, you look much, much better and more presentable. And tinted sunscreen is all you'll really need after that. But like I said, then I'll have a nice little post-care kit put together for you and make it super easy for you.
Sounds good to me.
Awesome. Well, everybody on the call, that concludes my portion of this shindig. I will kind of turn it back over to Jen. Jen, if you wanted to ask any more questions of anybody, or if you wanted to kind of conclude everything. I hope this was an interesting experience for everybody. Pam, I'm going to be keeping in touch through everybody to see how your results are.
Perfect. Thank you.
Yeah. Well, thank you everybody for coming. I think most of you have, met with me if you're interested. But if you haven't and you're interested, I offer a free hour consultation where we can kind of talk about, what your concerns are. I'm also going to, in the chat box, put a link in case that you are interested in any kind of financing options. Let me see, where'd I go? It's called Cherry, and that can be a good thing for people who want to just, have a payment plan. Let's see. Oh, let's see, Jim. I'm not sure. Let's see, sent to everyone. There we go. Okay, yeah, I think it went to everybody. So if you want to click on that link there, there are some, if you qualify, you might even get like a 0% interest rate. So that's something that if you want to explore, that'll be good. And then what was the other thing? Oh, another thing that I'm going to put in the chat box if you guys want to look this up. I really want people to have great results. So there is a new product called Essence. It's a growth factor, and it is FDA. This product is not FDA approved, but the growth factor is FDA approved in a lot of medical healing treatments. So like in surgery, in wounds. And so it is FDA approved for post procedures, so microneedling and lasers. It helps the downtime so that you heal a little bit faster. So who doesn't want that? And it's going to help rebuild your collagen. And it's kind of the latest and greatest right now. And so you'll be hearing more about that, but I include that in all of my laser packages. That's included in the price. So just know I am, investing in this because of course I want my patients to look the best. So just know that that's, an extra thing. And I have that in the chat box so that you can look that up. So it's reessence.com. And then you've got the payment plans as well. Is there anything else, Jim, that I'm forgetting?
Yeah, no, nothing you're forgetting, but I would like to add the price points that Jen is offering to her patients, and this introductory number is exceptional compared to some of the offices that I work with in Charleston, in Wilmington, in Raleigh. This is a really, really nice price point, and it's a great opportunity for you all to not only see how the laser works, but get great results and a really nice outcome. So if you wanted to take advantage of it, I think it's a good idea. Again, I just wanted to thank you, Jen, for having me on, for trusting Aclaro and UltraClear with your patients and with your practice. And I look forward to working with you.
Absolutely. Well, thank you so much.